You're watching once again a YouTube video presentation of the University of Wyoming Center on Aging. I'm Scott Veach. I'm your host, and on this program we'll be discussing topics of interest for caregivers of loved ones with dementia. We hope that you will subscribe to the channel and you'll hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new program. And now, this is Once Again. We welcome you to part two of our interview. Today, we're talking with Zane Rutledge, the music therapy supervisor at Vibes in Casper, and we're talking about the role of music therapy in dementia care. Hope you had a chance to check out part one of this interview. If not, it's already been posted. Should be right there next to it on our YouTube channel. We were talking about the value of music therapy for dementia patients. And in part one, as we concluded that, Zane, you were talking about what exactly takes place during your sessions. And we were talking about reminiscing, talking about getting folks active and actually the movement part, dancing if they're able. There are other parts of the session though too, right?
Yes, sir. Yeah.
And you mentioned that you actually get involved with some musical instruments too.
Yeah. So one of the most prominent parts of our group sessions, I always bring a plethora of percussion instruments with me. And then usually I kind of structure it as a three-part session. And in that third part,
Such as what kind of instruments? Let's go there.
yeah. So I'm looking at things like tambourines, drums, egg shakers, rhythm sticks. Every now and then I'll bring in something unique, like wobble sticks. They always think those are very funny. They're little. They look like tiny maracas with a rubber head, and when you shake them, they sound like little birds or turkeys. And so they eat that up. They think that's the funniest thing in the world and have a great time playing them.
And what actually takes place then once they've been given the instrument? Where do you go from there?
Yeah, so a big part of our memory care sessions, of course, we're working on cognition, and a lot of that happens through the active lyric recall that's taking place while they're trying to sing along and following along with the music. But I think anytime any of us think of a music experience, we think of the social aspect of it, right? We're at concerts or we're at football games or we're in a bar or wherever we are. Even Christmas carols are things that we sing together with other people. And something that we see a lot in the experience of individuals with dementia or Alzheimer's is that as the disease progresses, they become more and more isolated, which creates this really difficult feedback loop where, I'm isolated, so then I'm not actively practicing my social skills, which means I'm not engaging in cognitive recall or expressive language. And then because I'm not, those things diminish further. And then I'm a little more reluctant to engage in social interactions because I don't want to reveal to anyone that I don't remember these things or that I am struggling. And so then it creates this really negative feedback loop where they become increasingly isolated. And so a lot of that instrument portion in our sessions is actually to encourage interaction between residents and patients so that they are engaging in social experiences, and we're helping to make those very successful experiences to help try to break some of that feedback loop.
You mentioned when the patient who is living with dementia may have trouble communicating, may have lost vocabulary or the
Mm.
ability to put sentences together. There's something about music, though, that brings it back, isn't it? It's amazing.
So true. Yeah. Oh yeah, you
Tell me
see it
about
in
that.
real time. I'd be happy to. I think it's actually one of the most, I often talk about kind of all the quantitative data that goes into music therapy when I'm trying to, advocate for it. But I find myself often coming back to just the word magic, that to some degree, when we talk about language, it is kind of magical.
Yeah.
You'll have these patients that have progressed to a point where they have a really hard time even saying, like if their day was good or bad. They'll just give kind of a thumbs up or thumbs down, and even that you got to give them some time to get to. But yeah, after a few songs, they're telling me a short story about when they went fishing with their dad, or oh, you wouldn't believe how difficult my youngest child was when they were 2 years old. They were climbing over everything and they were knocking stuff down, and they were about as stubborn as could be. And it's moments like that that are so important for those individuals who, a lot of times throughout the rest of their week, they aren't interacting with the people around them and they're very reclusive, even if unintentionally.
Yeah. Here's a question out of left field. Do we know why that is? Do we know why music is able to connect in that way?
So I'll say this: I'm not a neurologist by any means.
Sure,
I've read
sure,
a lot of the scientific studies and research that support music therapy. So I'm going to give you a kind of as my answer in
sure.
that
Hmm.
there's so much evidence to help determine that music is a little unique compared to most other things that we experience in that it's stored actively in a lot of different sections of the brain. And what we see in the research that I can say definitively is that while verbal and episodic memory is usually deteriorated throughout the progression of dementia, procedural learning and specifically regarding music is actually maintained and oftentimes heightened throughout the progression of dementia to the point where a dementia patient who has no musical experience prior to music therapy can actually learn to play a new instrument.
Wow.
Uh, and you can see that I've actually done this with patients myself, and it's incredible to see week after week their ability to recall what happened, a couple of years ago, that major events is deteriorating and is becoming more and more difficult. But when you ask them to play an E major on the guitar, they know exactly where it's at.
Mm.
When you ask them how many beats are in the measure, even though they had no idea what that even meant a few weeks ago, they can pretty accurately tell you. And it's really incredible to see the fact that they are learning new things and then that can be used as a tool to further maintain or improve their cognition.
Right. I've been around folks living with dementia for, I don't know, 15, 20 years, probably about 18 years, and have seen folks everywhere along that journey. Do you get a response from everyone, most people, some people? Can you even categorize it that way?
Yeah. So it's always a little hard to know
Sure.
at first glance, I'll be honest.
Hmm.
And when we talk about, like clinical indications or like when a service is recommended for a patient or not, it's tricky because there's not really a lot of contraindications for music therapy, right? Like there's not like with heart medications, there's a lot of
Hmm.
confounding factors that you either do or don't prescribe. Whereas with music therapy, it usually just boils down to uh, do they hate it? Or do they have an abrasive response to music?
Yeah. Yeah.
So it definitely varies. I have some patients where I could play Puff the Magic Dragon and they've got 8 stories to tell me right off the bat. Whereas I have some where we'll spend 40 minutes just making music until finally they'll talk about an image that they're seeing. And
Yeah.
it's brief and it's very descriptive, but there's no storytelling in the same way. So it definitely is a little different for everyone, sure.
Zane Rutledge is our guest music therapy supervisor at Vibes in Casper. In part one of the interview, we would advise you, I hope that you'll check that out if you haven't already. He was telling us about the joint music therapy sessions that he conducts. We just mentioned it, reminiscing a little bit, even getting people to dance. You talked about passing out instruments, and we actually have a clip here that we'd like you to take a look at briefly of a session recently conducted here in Casper. We'll do that now. So we have an idea of what actually takes place during these joint music therapy sessions that you conduct. Before we began taping, we were talking about the caregiver
Hmm.
herself, um, and the fact that they can also benefit from these sessions. Tell us a little bit about that.
Yeah, so I think to some degree, music therapy is a little unique in that regard, in that a lot of our services are just as much kind of geared towards those caregivers. I'm sure a lot of the viewers and listeners have experience with being a caregiver for an individual with dementia, whether it be professionally or personally. And If you have, then I probably don't have to be the one to tell you that a lot of the times you can't really authentically fulfill both the role of being that person's loved one and that person's caregiver at the same time. Even if you're trying your best to do both, it really predominantly feels like you're being one or the other, um, which is an emotionally difficult thing and a really draining thing for those
Hmm.
caregivers, to the point where there's even, research to suggest that uh, the caregivers actually develop dementia at a greater rate due to the stress of being that caregiver. And so, I think one of the really big things that I get to provide is, at the very least, for the 30 minutes that I'm there, you are no longer the caregiver. You are just that person's husband, wife, daughter, father, cousin, uncle, whatever it is. And your job is to sit on the couch next to them and talk with them and tell stories with them and make music with them and interact with them like you would have if they didn't have dementia at all. Um, but I think, even going a little bit further than that, it's not uncommon for me to have a patient that is at a point in their dementia where they aren't fully aware of the difficulty of that caregiver. Um, And so it's not uncommon for me to, at the end of a 30-minute session, to spend 5 or 10 minutes just doing some verbal processing with the caregiver, making sure that they're okay because they now have a very different reality than before they were a caregiver. And it wears on them. And it's tough to see, also that I'm, yeah, caregiver, but I'm also watching my dad, remember me less and less, and some days not even recognize who I am. And so, what I always really love to make sure that I inform caregivers of is one of the, I think, really exciting things about music therapy treatment for individuals with dementia is that about 90% of, and that's not even a made up number, about 90% of that initial impact size regarding cognition and reduction of behaviors that are difficult persists about a week after the session. And so, as long as I'm seeing that individual once a week for 30 minutes, not only are they more cognitively lucid in the session, but their ability to interact with the world around them and manage their own behaviors and have meaningful interactions and experiences throughout the week is drastically improved, which not only makes, yes, their quality of life better, but that caregiver then gets to be a loved one a little more because they're not having to manage behaviors quite to the extent. They're not having to, help with every cognitive task throughout the day, that they're able to complete some of those tasks by themselves, which means, I get to just be their daughter again. I get to just
Hmm.
be their son or their brother.
Boy, there's so much to talk about, and I feel like that we've only scratched the surface of it here. I want to ask you what's the benefit that you get? Because it seems like to me it's almost a calling in life to do what you do.
Oh gosh. Funny enough, Scott, I originally, when I kind of decided to be a music therapist, I wanted to work solely in older teen and adult inpatient mental
Hmm.
health, which, I still do a lot of that. We run pretty frequent inpatient psych groups at Wyoming Behavioral Institute. But I think for me, I've really learned to love the work that I get to do with my individuals with dementia and Alzheimer's. I think for me, it's seeing the transformation happen and seeing the impact it has on the caregivers that are in the session, that I can only imagine how difficult it is to feel like the world around you is becoming increasingly more limited and being aware that these limits are being in place, but not necessarily understanding why. And as silly as it sometimes looks from the outside, and as unserious as a lot of my sessions really are in terms of what we're talking about and what we're doing, um, I think it's sometimes best painted by, I see a patient on Friday mornings, and I've worked with this man for about 3 years now, and we sing Puff the Magic Dragon every single time I see him, and it's his and his wife's favorite song. And I can visually see from the beginning of that 30 minutes to the end of that 30 minutes, he goes from withdrawn and lethargic and, to some degree, a little closed off to the world to singing and making jokes and giving his wife grief in a really positive way and, joking about how she pushes him down and makes his life hard, even though she does so much to help him. And we play this game where every time we get to the line in a land called Honolulu, he likes to pause and insert in a bunch of other names, which demonstrates to me that he knows that it's actually Lee, and he's just messing with me. And we'll sometimes throw out 15 names before he'll finally break down laughing and run out of names and finally say Lee, and we continue. And I mean, it's almost like he is a different person by the time we're at the end of that 30 minutes. And at the end of that session, every single week without fail, his wife comes up to me and tells me that I have no idea how much I've done for that man and the way it affects him throughout the week. And in a world that constantly is giving people obstacles and difficulties and making life harder, and it is a great privilege of mine to get to be involved in something that makes someone's experience a lot easier in a way that there aren't a lot of other ways to do that.
Over the years, I have asked many people that question, and often I get a very short answer. I can tell when someone goes into great detail that they feel very passionately about what they do, as you just did. Zane Rutledge has been our guest. He is the music therapy supervisor at Vibes in Casper. Thanks so much for being with us, and we thank you for being with us on this edition of Once Again. You've been watching Once Again, a YouTube video presentation of the University of Wyoming Center on Aging. We hope, if you haven't done so already, that you'll subscribe to the channel and hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new video. Thanks so much for being with us. I'm Scott Veach. We'll see you again next time.